Hey there, my name is Jim, and if you have come across this video, then you've likely been researching things like back pain, back surgery, lumbar surgery, microdiscectomy, or something like that. And what you've found here with me is the third in a small series of videos that I'm doing. The first one had to do with my first experience of pain and kind of uh, the course of action that I took trying to figure out what to do about that, how to fix it, and all that. The second video detailed kind of a crazy kind of occurrence that occurred and that happened during the middle of my searching for what to do and how it led me on the right path to what I eventually chose. And this third one will be talking about just from the day of the surgery, which is what I chose over conservative methods, and leading into where I am now, which is about 10, 11 weeks into the whole process, and just now 4 weeks past the date of the surgery. So the day of the surgery, pretty basic stuff. If you've never been in a hospital for this kind of thing, it might be a little daunting, but basically you just go to the hospital to fill out all the paperwork and all that jazz, and they get you in your room and you get you naked and put on their little stupid smock that you wear, and you sit there, and it's just kind of a waiting game. They'll come in and take your vitals and the various little things that they do pre-op, and eventually the surgeon will come in to see you, and mine did that, and we basically just talked for a few minutes, and it's kind of funny because I really wasn't the least bit afraid. He was kind of reassuring me, "Oh, I've done many of these. It's nothing to worry about." And I was like, "No, it's okay. I'm all good." And the reason I was all good was because I had been here on YouTube actually researching the same thing that you are, and a couple of the videos had really helped me, calm down and helped me make the decision to do the surgery instead of the conservative treatments. And I actually watched the exact surgery that they were going to do and was very comfortable with it. So I was like, yeah, okay, let's roll. And so in a few minutes, boy, I waited well past our appointment time, the scheduled time, but that's just how hospitals operate. They got other things to do and other surgeries before yours. But anyway, once the time came, it was like, bam, the team came in, the anesthesiologist talked to me, doctor talked to me, nurses and various aides were coming in and like doing this, doing that, doing the other, and they gave me some kind of beginning knockout drops, and I was like, and then they wheeled me off, and I don't really remember anything else except in the operating room I was awake, kind of awake and conscious for a moment, and then they were like, "Well, you're going to sleep now." I'm like, "Okay." And the next thing, of course, I remember is waking up in the recovery room, and so I was pretty groggy. But the surgeon went to visit my wife and kind of told her how it went. They said it was kind of more complicated than they thought. The 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 disc had the protrusion, the herniated disc material had kind of compressed the nerve root really badly and kind of shoved it into a place where it didn't belong, and kind of explained why I was in such pain. But basically said, it took longer than they expected. It was more complicated, but they did everything just fine, and it worked out great. Showed her a picture of the disc material. I never got to see it, which irritates me, but my wife saw it and said it was a pretty sizable chunk of stuff. But anyway, so in the recovery room, it was just me and one nurse, and I was groggy and asking her questions, and I know probably some of the questions were stupid, but I did finally kind of snap out of it. And what they do is you have to kind of be able to stand up, walk, go to the bathroom and such before they'll release you. So once I was finally clear-headed, they had me try to stand up. So I kind of rolled carefully out of the bed, stood up, and figured out where the restroom was and went to go to the bathroom. And the one thing I noticed was I was kind of drugged up. I couldn't really tell if I was pain-free, because I mean I was still on a lot of medication. But one thing I noticed right away was that my leg felt like it was my leg again. And prior to the surgery, it had felt like an attachment that I couldn't control and that was not reliable or dependable, and would buckle under me and stuff. Not to mention all of the pain that went with it. Like I said, I couldn't tell whether I was pain free or not, but my leg felt like it was my leg again, and that was really awesome. So I was encouraged by that. And once I was able to get up and go to the bathroom, it was like, get dressed, boom, you're out of the hospital. So now, what happened over the course of this last 4 weeks since the surgery is um, I've definitely still had a lot of pain issues, um, uh, and that should not scare you away. Particularly, what it appears to be is that the pain is related to the pain that you feel, and how long it takes to recover from it seems to depend on one, where the disc herniated, how badly it compressed the nerve, and how long it compressed the nerve. And I struck out on all three. Some people who get into surgery right away, they get the surgery, they're done, they're walking, and they feel fine, no pain or anything. I was not one of the lucky ones. Hopefully you will be, but I struck out, like I said, on all three counts. One, it was the location was like right on the nerve root ganglion, what they call. I'm not really super versed on that, but and it was a pretty sizable hunk of disc, so it had moved the nerve out of its position and was really compressing. And they call this area of the nerve the amplifier, and because it amplifies pain, and so yeah, well, great. And of course, by the time of surgery, it was 6 weeks from when I first felt pain. So I struck out, like I said, on all counts. So there was some pain stuff, and I was still on some pain medication, but it wasn't bad. It wasn't like before the surgery. It was definitely improved. And like I said, my leg felt like it was my leg again, so at least there was that. I had a few not sleepless, but sleep-troubled nights, and it was really weird because like I would feel like shooting electrical shocks, like cold waves going up and down my leg, and it was kind of freaky. But I started thinking to myself, that's probably the nerves like trying to reestablish communication with muscles and stuff. Now I don't know if that's exactly right, but they kind of hinted that was kind of accurate. It's been like cut off a long time, and it's now sending signals through this deadened kind of nerve that has been inactive, and it needs to reestablish communication. So I was okay. I can live with this. I don't like it. I still feel it here 4 weeks later. My leg is still numb in places. Still feels like in one area like I'm burned or sunburned, so I can't. I don't like to clothing touching it, or blankets or sheets even. Nothing feels good touching it. So there are a few issues, but they had me walking. You're supposed to get up and walk every hour for ever increasing lengths of time. And so I started with just kind of walking around the house, and then I got kind of outside and walked to the end of the street and back. Then it was around the block and back. And I've gradually worked up to where I'm up to a little over 2 miles 2 times a day. So 4.5 miles is my longest one so far. The pain has steadily decreased. I'm still having that shooting weirdness going through there at times, but my ability to sleep at night has improved. It's not waking me up as much. I weaned myself off of one of the pain medications, which, by the way, if you're on tramadol, wean yourself off of that crap if you can, because it's really awful. That's maybe a story for another video, but my body got addicted to that, and I had to really wean off of that stuff. So now they told me I'll continue to take this medicine called gabapentin, probably for a few months while the nerve is regenerating. But as I said, my leg feels like my leg. It's getting stronger. The pain is decreasing, and I had like a bad compression for a long time. So you may be a lot luckier than that. But if you weren't, if you're like me, just hang in there, because it'll get better. If the surgery is successful, it'll improve and get better. I started physical therapy last week. I just had my third visit today, and I can already tell a difference. So a lot of improvement. I'm at week 4, and it feels pretty good. Now, I'm going to tell you, I'm going to end this because it's getting too long again. But even me, I'm feeling pretty good, and was feeling a lot better after like a couple weeks, and you're really tempted to feel like you're okay to do stuff. And I'm going to tell you, please don't do the stuff, right? I just heard a horror story about somebody recently who, and I think it was from a physical therapist, who a guy got the surgery done, felt good after 2 weeks, and then started doing stuff and bouncing around and moving around, re-herniated that thing, and had to do the surgery all over again. Learned his lesson the second time and followed the rules. But so I'm telling you, follow the rules, and the main rules are BLT: bend, lift, and twist. No, don't do it. So you're gonna have to do a lot of relying on other people, and once you're able to do stuff, you're gonna have to do a lot of lunging, like keeping your back and your abs braced and your back still, lunging down to reach stuff that are just below your grasp, down below you. A lot of squats, sitting on the john. You'll have to like brace yourself and slowly lower down, that kind of thing. But it's really worth it. The physical therapist keeps telling me again and again, I know you feel good, go really slow, don't mess this up, And some of the videos I watched, and I'm a little bit older, I'm in my 50s, but I've seen videos of 24-year-old athletes, and they're like, can't do anything but walk for 3 months, no tennis, no nothing, can't do anything like that. You got to let that thing heal up. Supposedly, like the great majority of re-herniations occur within the first 3 months, and it's probably because people are feeling good and they overdo. So be super careful. You're going to feel, if you're one of the lucky ones especially, where you don't have a lot of pain right after, you're going to be tempted to do stuff, to bend over, to do for yourself. Just don't do it. Okay, so that's my big warning to you. And I'll stop it here. I'm at the 4-week point. Physical therapy has started, doing good, doing a lot of walking. You're going to have to make yourself be grateful that you can do that. Think about what it felt like before you got the surgery. So I'm super grateful that I can walk, super grateful that I can do physical therapy. I've been cleared to drive and go back to work. I have a fairly sedentary job. If you're a construction guy, you're not going back to work for a while. But if you have just a regular job where you sit at a desk or whatever, you can go back and do that pretty quickly. But I'll update this, I think, at the time of my next follow-up visit, which I think is in 3 weeks. And let you know I'm doing at about the 7-week point. But until then, thanks for watching, and I hope it's helped you some. And if you have any questions, feel free to put in the comments, and look in the videos for my recommended videos, the ones that helped me when I was trying to decide what to do. And whatever your decision is, best of luck to you and blessings to you. And talk to you later. Thanks. Bye.